we'll be talking about a miscarriage and how it happens, what we do, and what to expect with a miscarriage. Tell me what your experience is with any of these conditions that we're looking at, or in early pregnancy. Perhaps what you wish you'd known. I think that's also important. Perhaps what you wish you'd known. But here we're talking about miscarriage. A miscarriage is when a lady loses her baby or loses the pregnancy before 24 weeks. The most common cause is abnormality of the baby, of the developing baby, because remember, these are very early stages and development has been going on and is still going on at this stage. So the most common cause is abnormality within the baby, maybe some genetic problem or something that goes wrong during development and the pregnancy cannot continue. And so it's not something that in most cases a woman has any control over, and it's really important to say this. A miscarriage can also happen as a result of infection, whether it's a urinary tract infection, a sexually transmitted infection. It can happen as a result of severe stress or trauma, some type of injury. There could be other ill health conditions that are not quickly detected or that a woman might have that make her have a miscarriage, or it might be some drugs that can contribute. So you can go into detail with different possible causes, but in the majority of cases, like I said, there are abnormalities within the developing baby that we don't know about, we couldn't control, and the pregnancy is unable to continue. What does it look like when a woman is pregnant? So either she has a positive pregnancy test or she has symptoms that suggest she's pregnant. So she has not had a period, or her period has been missed for a few weeks or is late, and she's having tenderness in her breast, or even nausea. We just talked about morning sickness. So a woman who is pregnant, either because we've done a positive pregnancy test or she has symptoms which mean or tell us that she might be pregnant, we look at any type of vaginal bleeding, any type of bleeding, discharge from down below. One of the things that your doctor will consider is the possibility of a miscarriage. So it might be spotting, scanty bleeding initially. You might have brownish discharge coming away or bright red blood coming away. It might start and then progress continuously for the next few hours or days. In some other ladies, it might start, happen for a few hours, stop, then start again after a few hours of the following day, stop, then start again after a few hours. So there isn't an exact pattern, is the message I want to get across. So it could happen in any of these scenarios. What we do know is that there is unexplained and unexpected vaginal bleeding. We have to take it seriously. The other thing that could happen to this woman who is pregnant is pain, and usually that pain is crampy type pain in the lower abdomen, okay, and it may also extend to the back. So she might have backache after the bleeding starts. Okay, so when you have these, if you experience these, you're pregnant, i.e. or you're not even sure you're pregnant, but you might have those symptoms, and you now develop bleeding that's unexpected, out of schedule. It might be spotting, it might be heavier, it might be fresh, and you start to have cramping, low abdominal pain, then it's important that we're seeing you. It's important you're talking to a health provider. The other reason for that this is so important, and I'm just going to mention it by word quickly, is because of an ectopic pregnancy where the symptoms can be so similar, and we have to establish, it's important that we see you to establish whether it is this one going on or that or the other, miscarriage or an ectopic pregnancy going on. So when you come to see the doctor, what do? We will look at your vital signs. They're so important. So from checking things like your blood pressure and pulse, and all that is really to establish that you don't have internal bleeding, which is a more likely outcome if there's an ectopic pregnancy and perhaps it's growing in the tube and it may have burst the tube. It's important that we do that assessment. We'll do a urine test. Some ladies may be established, we know they're pregnant, some may not be. So one of the first things that will happen is a urine test to check that whether or not you're pregnant. That urine test is also useful because it could tell us whether or not there's an infection going on that may be responsible for this bleeding. Not in all cases, but you can see that we're thinking of possibilities so that we can narrow down what might be responsible, what might be going on. Blood tests can also be done, and that blood test is looking at your hormone level. This is the beta HCG that we use to establish that as soon as fertilization happens, its levels start to grow. And what we have found is that specific certain levels are associated with certain stages of pregnancy. So when we see that the level is going up and continuing to go up, that indicates that pregnancy is progressing. But if it gets to you do a test and the level is lower than you expect, you do it the next day and the level is static, it's not changed, then you think, is this pregnancy going on? So that's how we use the beta HCG. The definitive diagnostic tool, or what we use to establish whether a miscarriage is going on or not, is the transvaginal ultrasound scan. This is why if you call out to your doctors, we either arrange an appointment to see you or we arrange an assessment for you at the early pregnancy assessment unit so you can have a transvaginal ultrasound scan. And by transvaginal, I mean that the scan will be conducted with a probe, an ultrasound probe that is inserted through your vagina, just so that we can clearly see the body of the womb. Device on the top, rubbing it across the top of your abdomen, may not give us a very good look of the womb, and to see properly into the body of the womb where the baby should be lying. So a transvaginal ultrasound is preferred to check on the progress of the pregnancy, and what we're looking at is the size, most importantly the absence or the presence of the baby's heartbeat, and that tells us what's going on. If the heartbeat is not present, then that tells us that we're dealing with a miscarriage. So what happens next? Okay, what's the treatment? We said, okay, we think we have a miscarriage, there's a miscarriage going on. What happens next depends on the mother's well-being, and of course what she prefers, what the intention is. And the reason I say that is, we're doing all these tests, we're checking your blood pressure and pulse, we're checking your hormone levels. One option is what's known as watchful waiting, and it looks as if nothing is being done. Well, nothing is being done, but monitoring, allowing nature itself to do its thing is the best way to put it. So just events to happen naturally. And what do I mean? When the body realizes that this pregnancy is not continuing, then that message is sent to the different organs that need to act, and that allows the cramping process, where the contraction process and the womb tries to gently move this pregnancy that's no longer valid out of itself. So that can be the natural outcome of watchful waiting. And another option is having drugs to do the same, which is to trigger the womb to start contracting. That might be an option depending on how well or how ill the woman is, or by choice. And of course, another option is surgery. I'm going to talk about that in a little bit. So when we're doing watchful waiting, it's also known as expectant waiting. It's usually, we don't sort of wait months and months, no, usually over a course of 7 to 14 days, okay? And what you might expect is steady bleeding as the womb is emptying, okay? And as we get to the 7th day, get into the 2nd week, the bleeding should begin to get lighter. If the bleeding is not getting lighter, if the bleeding is getting heavier, if you're experiencing more pain or any other symptoms, you should seek medical attention. The whole process should be done within those couple of weeks, and you're usually advised after 3 weeks to do a pregnancy test. And if that test is positive, then you have to go into hospital so that we can again do a scan and work out what's going on. The next method I talked about is medical treatment, medical management, where you're giving medicine to stimulate the womb to start contracting. So this tablet can either be a tablet that you take by mouth, oral, or it might be one that's applied by the vagina, and the hormone is supposed to stimulate contraction and help empty the womb. And of course, we would have done the scans, and the scans have told us that the fetal heart is not present. This option might be suitable if a woman chooses, she doesn't want to wait, she prefers something just to help, I just want to move from stage A to stage B, I don't want the long wait, or your doctors feel that watchful waiting is not the best option for you. And again, the advice is given to watch out for abnormal bleeding, very heavy bleeding, with clots, feeling very ill, very severe pain, because what women can expect to have some crampy discomfort that can be managed with simple paracetamol. So where pain is present, that is prolonged pain, severe pain that doesn't go with simple paracetamol, that's not normal when you're having any of these treatments, and you should seek attention of your doctor. So the third method is the surgical method, and this is the method where either under local or general anesthesia, the doctors go in to empty out the womb, and it is the quickest. The result is fast. As soon as the surgery is over, then the pregnancy has ended. So that for some people might be a preferred option, because like I said, people want to move from stage A to stage B, and not go through the whole process of waiting and waiting. This is something that has so much emotional impact, but I think what is of value is being aware. If ever a woman has to go through this, being aware of these different options and the supportive treatments that are available after it happens. In each instance, everyone should be offered counseling. This is bereavement. This is the loss of a loved one. And so it's important to take some time to go through this and recover, instead of sweeping it away or ignoring it or not speaking about it. So surgical methods, please don't forget, possible complications can include an infection, very heavy bleeding after surgery, severe pain. Please bring to the attention of your doctors as an emergency. Thank you again if you're joining me on live, and if you're joining on the replay, thank you so much. Guys, don't forget to like and subscribe to the channel.